I'm your pelvic health physiotherapist, Natalia Vasquez. Today, I'm explaining the first part of your home exercise plan. And I have this pelvis here, which looks exactly like your pelvis. So the first thing I like to explain is how to find your pelvic floor muscles and how to feel them. So for that, I would like you to visualize your pelvic floor as a sheath of muscles that go from your pubic bone at the front all the way back to your coccyx and from your sitting bone to sitting bone on the sides. This is literally the floor of your pelvis. So what I would like you to do is to imagine and visualize that pelvic floor as a lift inside your pelvis. And I'm going to talk about back doors as your back passage and front doors as your front passage or front passages in women. At the moment, I'm going to put these down and I'm going to ask you to follow me and try to do this exercise. With yourself in sitting position, with your back straight but not rigid and your feet on the floor, I would like you to imagine that pelvic lift with the doors completely open. So imagine the doors of that lift completely open and relax. Now, I would like you to close the back doors, and that is your back passage, as if you were stopping yourself from passing wind. Before we carry on, I'm going to also ask you to put a hand on your stomach and try not to use those muscles and try not to use your buttocks or legs. So let's try again. Imagine closing the back doors and pulling the lift up towards your head and keeping the lift there for 3, 2, 1 second. And now let the lift drop and open the doors. Let's try again. Imagine yourself closing the back doors and bringing that lift up towards your head and keeping it there for 3, 2, 1 seconds. Now let the lift drop, open the doors for 3, 2, 1 second. That is the first pelvic floor exercise I'm going to ask you to do. And I'm going to call that one the long one because I'm asking you to hold. Now we're going to do the second one, and that's going to be called the quick pelvic floor exercise. For that one, in the same position, remember, feet down and your back straight but relaxed. You're going to close the back doors nice and tight and you're going to open the doors. You're going to close the back doors and you're going to open the doors. Now, I would expect that you feel yourself doing these exercises. But if you're not, something that can help is using a small hand towel rolled up and sitting on it like this. Sometimes that can put enough pressure on your pelvic floor for you to feel it more clearly. So in that position, I want you to try again and do it with me. I want you to close the back doors, hold them closed for 3, 2, 1 second and let it open. For 3, 2, 1 seconds. Now remember, try not to use your stomach muscles, try not to use your glute muscles. And also remember that nobody should see that you're exercising your pelvic floor muscles. Okay, so I've given you 2 exercises, one long and one quick. Now the third exercise that I'm going to ask you to do is one with coughing. And this is how you're going to do it. You're going to close the back doors and bring the lift up and keep it there as you cough. And now you're going to let the lift drop and open the doors. Let's try again together. Close the back doors, bring the lift up and keep it there and cough. Let the lift go and open the doors. And that is the third exercise that I'm going to ask you to do. Now, your exercise routine for the next couple of weeks should look like this. You're going to do 5 long pelvic floor exercises, 5 quick pelvic floor exercises, and 2 pelvic floor exercises with coughing. And you're going to do that whole routine 4 times a day. I'm going to ask you to do that in different positions because we don't spend our whole day sitting and we need those muscles to work when we're lying, when we're standing, when we're sitting. So once a day, I would like you to do that whole routine when you're lying down, nice and relaxed. Twice a day, I'm going to ask you to do that in this position. So in sitting position, on a hard chair, using, if you like, a small towel between your legs to give you a little bit more pressure and giving you more sensation of those pelvic floor muscles working. And once again, you're going to do that exercise or the whole routine of exercises, but in standing position. I would like you to do it with your feet slightly wide, but also sort of pointing out. And that is going to help you feel those back doors closing properly and then open properly as well. For now, that's all I'm going to ask you to do. But in 2 weeks' time, I will see you again with more recommendations and more exercises. Best of luck and bye for now.